Okay, so now, we have discussed few things about lumbar plexus. How is it formed? L1, L2, L3, L4, isn't it? So, and these nerves like iliohypogastric, ilioinguinal, genitofemoral, lateral cutaneous, obturator, and femoral are the branches. Okay, among them, femoral and obturator nerves are the usual important questions. So we are finding these branches. Where is this lumbar plexus formed? Within the substance of psoas major muscle. Now, if you talk about iliohypogastric and ilioinguinal nerve, they go and supply the skin of anterior abdominal wall. If you remember the intercostal space class, in the intercostal space class, what did we study, beta? Like between the ribs, we have intercostal nerve, and the last intercostal nerve, I said subcostal nerve, which supplies abdomen. Similarly, iliohypogastric, ilioinguinal nerves also supply anterior abdominal wall. We have genitofemoral nerve, which is supplying the skin of thigh, and also it supplies cremaster muscle. So where do we find this cremaster muscle? We find in the skin of, like in the layers of scrotum. Okay, so there it goes and supplies genitofemoral. Then obturator we will discuss in detail. Actually, it's important nerve which is supplying the medial compartment of the thigh, adductor compartment of the thigh. Do you remember what are the muscles we see in the adductor compartment? Medial compartment of thigh, we have adductor longus, adductor brevis, adductor magnus, gracilis, and which one, beta? So these a part of pectineus is also seen, isn't it? So these are the muscles of the adductor compartment which are actually supplied by the obturator nerve. Now the front of the thigh is supplied by the femoral nerve. Okay, so all these nerves are again highlighted and shown. Now let us discuss in detail. I said femoral nerve is very important topic. It can come as an essay question. So this is the front of the thigh. Let me give you the orientation of the things so that when you study from the textbook also you will understand. See, this is anterior superior iliac spine and this is pubic tubercle. You have a ligament extending here, that is inguinal ligament. So below the inguinal ligament, this is the femoral triangle, isn't it? So how is the femoral triangle formed? Sartorius, adductor longus and inguinal ligament. These are the boundaries. So van structures we see in the femoral triangle, right? That is femoral nerve, femoral artery and femoral vein, femoral artery and femoral nerve. So when you look into the femur, what are the muscles of the front of the thigh, beta? Niharika?
Adductor, minor.
No, not adductor. No, beta. It starts something like this. Rohita, do you
Like
remember the names, beta? Front of the thigh. All together they are called as quadriceps femoris. Isn't it? Kirti, name the muscle.
gra- gracilis.
Okay, Niharika, now you remember?
Vastus medialis,
Very good.
vastus intermedius,
Excellent.
vastus lateralis,
And
quadriceps, rectus femoris, rectus
excellent.
femoris.
Very good. Very good. If you answer, no, the other students will remember better if one of the student answers. Okay. So we have rectus femoris, vastus medialis, vastus lateralis, vastus intermedius, and rectus femoris. These are the four muscles we see in the front of the thigh. Okay. All these muscles of the front of the thigh are supplied by which nerve? Rohita, which nerve is supplying front of the thigh?
Obturator nerve, femoral nerve,
Yeah,
femoral nerve.
femoral nerve. Very good. Femoral nerve supplies the front of the thigh. Medial compartment of the thigh, which nerve?
Obturator nerve,
Very
back
good.
compartment, sciatic nerve, back
Very
posterior
good. Very
sciatic.
good. Back of the thigh is sciatic nerve. Excellent. Very good. Nice. Okay. Now, if you see the previous picture, the femoral nerve, this which is the femoral nerve? I said this thicker one. So it is coming from L2, L3 and L4, the posterior divisions of these anterior primary. Posterior divisions will join to form this femoral nerve. You can see it is passing below the inguinal ligament. Hence the root value is given like lumbar plexus L2, L3 and L4. It is descending lateral to the psoas major muscle in the abdomen. It enters the thigh behind the midpoint of the inguinal ligament. It passes lateral to the femoral artery. Okay, now listen carefully. It is dividing into anterior division and posterior division. Okay, anterior division is cutaneous. Okay, that means it supplies skin, but there is one exception, it supplies one muscle also. Do you remember which muscle it supplies beta anterior division?
Sartorius.
Yes, very good. It supplies sartorius and exclusively skin only, anterior division. Okay, it is cutaneous, and the cutaneous branches are anterior, and intermediate and medial cutaneous nerves of the thigh. Posterior division is supplying all muscles, what Kirti told us just now. Vasetus medialis, lateralis, intermedius, and rectus femoris. They are all supplied by which division of femoral nerve?
Posterior division of
Very
femoral
good.
nerve.
Posterior division of femoral nerve. Okay. So all these muscles, like overall, like femoral nerve, it supplies like this is the iliacus muscle which we see in iliac fossa. Okay, it supplies the muscles of the anterior compartment of the thigh. What Kirti told just now. It is also supplying sartorius. Okay, through its anterior division and pectineus. It supplies knee joint. All four muscles together. What do we use the word beta? All four muscles together.
Quadriceps femoris.
Quadriceps femoris. What
Quadriceps
is the
femoris.
sesamoid bone, Niharika? In the quadriceps.
Patella.
Excellent.
Like
Patella.
patella.
This is the largest sesamoid bone which is developed in the tendon of quadriceps femoris.
Quadriceps femoris.
Nice. Very good. Very good. Okay, beta. So I said femoral nerve anterior division is becoming cutaneous, right? So what are the branches we have, beta? Anterior femoral cutaneous nerve, and we also have intermediate, anterior and medial and intermediate cutaneous nerves of the thigh. This orange shade, 1, 2, 3, whatever you are finding, they are actually derived from the anterior division of the femoral nerve and supplying the skin of the thigh. Okay, so it supplies the anteromedial aspect of the thigh. It also supplies the medial aspect of the knee and leg. Okay, so now anterior division, now listen carefully. Anterior division is cutaneous, I said, no? So the cutaneous termination of femoral nerve is called saphenous nerve. Do you remember beta yesterday when we were doing great saphenous vein? I told you great saphenous vein is very close to the femoral nerve, isn't it? Like saphenous nerve. So saphenous nerve is basically cutaneous division of femoral nerve. It is the cutaneous branch of femoral nerve. So violet area is all supplied by femoral nerve only, but through its anterior division, the cutaneous branch. Okay. So it supplies the medial aspect of the knee, leg. Okay, like that. So foot, we will see what is this. This is all saphenous nerve beta, which is supplying. Now, femoral nerve because it is supplying the front of the thigh muscles. So suppose if these muscles are paralyzed, what are the movements which are affected? Let us see. So suppose iliacus, this is our iliacus, which is also supplied by femoral nerve. If it is paralyzed, person will lose flexion of the hip. This is sartorius, talar muscle. Tailors will use this muscle more while making the movement of hip and knee while stitching. So flexion of abduction of hip is lost. Pectineus, if this is paralyzed, flexion and adduction of hip is lost. If all four muscles are damaged, quadriceps femoris is damaged, extension of knee is gone. Okay. So now motor manifestation. Suppose the femoral nerve is injured. This though actually the area which should not be covered is covered here in this picture. The quadriceps femoris muscles, they look very thin, like marasmus picture. Kwashiorkor marasmus, you will have that picture in mind, no, biochemistry. Skinny appearance. Why is it happening? Because nerve supply is not there and wasting of quadriceps femoris, loss of extension of knee and weak flexion of hip. Okay. So these are the motor manifestations in femoral nerve injury. And we know like where is the sensory supply? This orange area. Orange area, violet area. This is all supplied by femoral nerve. So the sensory loss will be there. Loss of sensation over the area supplied. Anteromedial aspect of the thigh, medial side of the knee, leg and foot. Okay, the question may be framed in this way if the femoral nerve comes as an essay. So the patient has come with wasting of the muscles of the front of the thigh. There is loss of extension of knee and there is weak flexion of hip. So there is loss of sensation over anterior aspect of the thigh. Identify the nerve, write the root value and discuss the area of distribution and write the applied aspects. Usually question will be framed based on applied anatomy. So applied anatomy we should learn properly better. Okay, so that finishes femoral nerve. Once we are done with femoral nerve, then we have sacral plexus. L1, L2, L3, L4, they went to form the lumbar plexus. So what we are left with now? L5, S1, S2, S3, S4. They join to form the sacral plexus. The anterior, that is the ventral primary rami of all these nerves are uniting to form sacral plexus. So that was in front of psoas major muscle, that in the abdomen. This is in front of piriformis muscle. This is our piriformis muscle in front of piriformis. Now, basically, like I told you, like brachial plexus, you need not go much in detail about.
Can you show that picture again
Yes, sir.
behind?
This one. This is
Yes, yes.
pelvic cavity, beta. This is pelvic cavity. You are finding sacrum bone, right hip bone, left hip bone. This is levator ani muscle here. This is piriformis. Over the piriformis, you are finding this sciatic nerve, thickest nerve of our body, which is formed by the union of L4, S1, S2, S3, S4. They all will join to form sciatic nerve. Actually, this is sacral plexus. Okay, Khurram, can I move now?
Yes, ma'am. Okay.
Okay, beta. So, as you learn the details of brachial plexus, you need not learn these pictures are not actually till now it has never been asked. So I don't want to trouble you with, and I will tell you everything, but don't trouble yourself by learning. Okay, give this rough picture because formation of sciatic nerve is important only, beta. But other branches you can ignore. Okay, just give L4, L5, S1, S2, S3 and give this like formation of sciatic nerve. The other labelings you can ignore. Okay, but if you are trying to learn the smaller details, you may forget the important things. Now we have very less time, no? So unnecessarily do not waste your time. Okay, so all these are not actually important. Whichever are important, I'll tell you. See, sciatic nerve, from where is it formed? Sacral plexus. What is the root value? L4, L5, S1, S2 and S3. They are joining to form the sciatic nerve. So this is the largest branch of the sacral plexus. Okay, and it is the largest nerve of the body, thickest nerve of our body. Okay, now sciatic nerve. So don't read anything, I'll give you a very good picture. This is the back of the thigh and this is the gluteal region. So first muscle in the gluteal region we have is gluteus maximus. If you cut gluteus maximus, we will see gluteus medius. Below this, we will have gluteus minimus. The key muscle of gluteal region is piriformis. Now we are seeing from behind. Actually, sciatic nerve was formed in front of piriformis only. Now you are seeing from behind. So below piriformis, you are finding sciatic nerve has come and it is running down. Though it is seen formation and course has started in gluteal region, it is not supplying any muscle of buttock region. Remember, sciatic nerve is not supplying gluteal region. Okay, it is now running at the back of the thigh. So at the back of the thigh, what are the muscles of the back of the thigh? Rohita, do you remember?
Hamstring muscles, ma'am.
Yeah, very good. Can you name them?
Semitendinosus, semimembranosus, biceps femoris.
Excellent, very good. Semitendinosus, semimembranosus, and biceps femoris. There is one more muscle. Can anybody add me that muscle? Which is seen both in medial compartment and also posterior compartment. Niharika?
Adductor magnus.
Very good, very good. Adductor magnus also we see here. Okay, all four muscles are belonging to posterior compartment of the thigh. So this sciatic nerve is coming into the posterior aspect of the thigh. It supplies all these four muscles. And what is this fossa behind the knee joint called as?
Popliteal fossa.
Very good, popliteal fossa. So at the upper part of the popliteal fossa, sciatic nerve is dividing into two terminal branches. Can you name them? What are the terminal branches? Kirti, Niharika, Rohita, Hanisha.
Common peroneal nerve.
Tibial nerve.
Common peroneal nerve, tibial nerve.
Very good. The terminal divisions of sciatic nerve are common peroneal nerve,
Common peroneal
Common
laterally,
peroneal nerve.
laterally, very good. And tibial nerve,
Yes, ma'am. Tibial nerve.
medially. Okay, very
Tibial.
good. Yeah,
Yes, ma'am.
yes, very good. So that's what. See, sciatic nerve is leaving the pelvis through greater sciatic foramen. Okay, it is running below piriformis. It passes in gluteal region between, this is our ischial tuberosity and the greater trochanter of the femur. Ischial tuberosity, greater trochanter. Then it is entering into the posterior compartment of the thigh. It divides into two terminal divisions, tibial and common peroneal. Okay, now this is our popliteal fossa, and this has divided, see, from the greater sciatic foramen it has come down. It has supplied the posterior compartment of the thigh. As Kirti said, these are hamstring muscles, hams. Okay, and in the popliteal fossa, it has divided into two terminal divisions. Tibial nerve is coming straight down at the back of the leg. It supplies the muscles of the back of the leg, tibial nerve. No? Then common peroneal nerve is moving laterally. Sacrum is towards midline, right? So this is laterally. At the neck of the fibula, common peroneal nerve will divide into two. What are those? Superficial peroneal nerve and deep peroneal nerve.
Deep peroneal nerve.
Yeah.
Biceps femur is also lateral, ma'am. Biceps femur is also lateral, ma'am.
You mean to say the boundary of popliteal fossa? Yes.
Yes, ma'am.
Superomedially, we have semimembranosus and semitendinosus. Biceps femoris we will have on the lateral aspect, muscle. And
Yes,
the nerve
ma'am.
is going,
Yes, ma'am.
going laterally only. This is our common peroneal.
Common peroneal nerve.
Yes.
Common peroneal nerve.
Yes, very good. So branches of sciatic nerve, now see here. So it goes and supplies the hamstrings to all muscles below the knee. Common peroneal nerve, it divides, no? I will show you into the tibial and like superficial and deep peroneal nerves. So muscles of the anterior compartment are supplied by the deep peroneal nerve. Muscles of the lateral compartment of the leg are supplied by superficial peroneal nerve. Okay, so these peroneal nerves are basically, it is bringing about dorsiflexion of the ankle, extension of toes and eversion of foot. Okay, tibial is this one. Do you remember the muscles of the posterior compartment of leg, beta? Anybody?
Gastrocnemius.
Ah, very good. Medial and lateral
Soleus.
side of gastrocnemius, excellent. Soleus,
Medial and
plantaris, tibialis posterior, flexor
Tibialis
hallucis
posterior.
longus, flexor digitorum longus. Very good. Okay.
Flexor
All these
digitorum
muscles are actually supplied by tibial nerve. Okay. Then.
Yes, ma'am.
So now, as we have seen, this was our femoral nerve anteriorly. Similarly, now sciatic nerve also will have cutaneous distribution. So it is supplying, cutaneous supply of the sciatic nerve is going on the posterior aspect of the leg and also the foot. Okay. So areas of like the cutaneous divisions of sciatic nerve is actually the saphenous. The saphenous was femoral nerve. So except for femoral nerve, whatever area is left, no, that is all supplied by sciatic nerve, cutaneous branches. Now let us see tibial nerve. So we know like this is popliteal fossa, gastrocnemius, heads are cut, soleus is cut. We can see popliteus muscle here. You are finding tibialis posterior, then flexor hallucis longus and flexor digitorum longus. Tom, Dick, Harry is the code beta. Tom, Dick, Harry. T tibialis posterior, like flexor digitorum longus, H flexor hallucis longus. Like that you can remember. So the tibial nerve is supplying all these muscles, descends through popliteal fossa, enters into the posterior compartment of leg. It is accompanied by posterior tibial vessels. We know popliteal artery divides into anterior and posterior tibial artery, no? So it passes, now see, this is the medial malleolus. It passes behind the medial malleolus of the tibia bone and then entering into the sole. This is the sole of the foot. So there it supplies almost all muscles of the sole. Like we had muscles of palm. Similarly, we have muscles of sole in 4 layers, isn't it? So actually the tibial nerve divides medially. It is called as medial plantar nerve. Lateral division of tibial nerve is lateral plantar nerve. We have medial plantar nerve, lateral plantar nerve. Okay, these are the terminal divisions of tibial nerve. Huram, are you understanding?
Yes, ma'am.
Now, common peroneal nerve. So, before I take you to any text part, we have seen, like just now, Kirti was asking me, is it going towards biceps femoris side? Yes, this is the lateral aspect. So, this is our common peroneal nerve, which is moving laterally. It is coming towards the neck of the fibula. At the neck of the fibula, common peroneal nerve divides into two. It is dividing into superficial peroneal nerve
Superficial,
and
deep peroneal nerve.
very good.
Deep peroneal
Superficial,
nerve.
excellent. Superficial peroneal nerve supplies lateral compartment muscle. Only two muscles we have there. What are those? No,
Gastrocnemius,
no, no. Lateral beta. This is lateral compartment. Rohita, what are the muscles in lateral compartment? Niharika, Anisha,
tibialis
peroneal.
post.
No, beta. Lateral compartment, not post. Forget posterior now. We are talking about peroneal nerves, no?
Yes, ma'am.
Peroneal word also you can remember. Peroneus longus, peroneus brevis.
Long voice.
Okay, these are
Peroneus.
lateral
Yes, ma'am.
compartment muscles. Now, so that is which nerve is supplying? Superficial nerve. Superficial nerve is supplying peroneus longus and peroneus brevis. Deep nerve will go in the front of the leg. Okay, let us see. Stepwise I'll take you. See, common peroneal nerve, this one is leaving the popliteal fossa. It is moving on the lateral aspect. Obviously, what is the lateral bone we have in the leg? Fibula. So you can see,
Fibula.
yeah. So this is the neck of the fibula where it is going. So that's why neck of the fibula is very thin. Suppose if the person is falling and if there is a fracture in the neck of the fibula, all these muscles will lose nerve supply. Peroneus longus brevis will lose. Front of the leg muscles also will lose nerve supply. Then person will suffer with a condition called as foot drop. Foot drop. That's why this is called as dangerous position.
Drop.
The nerve becomes very much subcutaneous here, so that if there is any damage at the neck of the fibula, person will lose nerve supply to all the muscles of lateral compartment, front of the thigh. I'm sorry, front of the leg. Okay, let us see. That's why dangerous position. See, common peroneal nerve is dividing into two. What are those? Superficial peroneal nerve. Nobody uses musculocutaneous. Better delete this. Our Indian authors, we don't use. Two. So, superficial peroneal nerve. Where is it supplying? Lateral compartment of leg. What are the muscles, Kirti? Lateral.
Peroneus longus, peroneus brevis.
Very good. Does anybody remember what are the muscles of front of the leg? Deep peroneal will go into the front of the leg. Okay. Don't remember anterior tibial. You'll get confused. Delete these words. Not required. Deep peroneal supplies the anterior compartment of the leg. Beta. Anterior compartment. Anybody remembers the muscle names? Beta. Anterior compartment. Front of the leg. We have tibialis anterior. Extensor digitorum longus. Extensor hallucis
Extensor
longus.
hallucis longus.
Peroneus tertius. Peroneus
Peroneus
tertius.
tertius.
4 muscles are there. Okay. So those 4 muscles are supplied by which nerve?
Deep peroneal nerve.
The peroneal nerve. Okay. Now, so that means that you have to talk everything if sciatic nerve is asked. You have to talk about common peroneal and tibial nerve also. And sciatic nerve, basically, when we give intramuscular injections, so where should we give the injection, beta? The upper and outer quadrant is basically considered safe because below piriformis we have sciatic nerve, right? So suppose if we are giving in any other quadrant, sciatic nerve may be damaged. Okay, and person may suffer with the like numbness and pain along the distribution of the nerve, and the muscles also will get paralyzed. Okay, so sciatic nerve is frequently injured, like in road traffic accidents, also very dangerous. Okay, so like badly placed intramuscular injections in the gluteal region, then that's the reason we have to give only in upper outer quadrant. Okay, 90% of the injuries, the common peroneal nerve is the most affected. Why common peroneal? Because common peroneal is very much superficial, I said, no? It is coming very close to the neck of the fibula, very much superficial it is. Okay. Now, sciatic nerve injury. Sciatic nerve, see, it is supplying front of the leg through deep peroneal nerve. It is supplying lateral compartment of the leg through superficial peroneal nerve. It is supplying back of the leg via tibial nerve. So obviously, if this nerve is injured, marked wasting of muscles below knee. See, this is normal and this is wasting. Below knee, the muscles are wasted. Okay. So, the what are flexion? What are the clinical picture the patient presents with? So, weak flexion of the knee and weak extension of hip. Sartorius gracilis are intact. That means they are supplied by femoral nerve and obturator nerve. No, that's why at least some flexion of knee is found. Weak extension of hip because gluteus maximus is intact. Gluteus maximus is supplied by which nerve? Inferior gluteal nerve.
Inferior
Okay.
gluteal nerve.
So that is, so all muscles below knee are paralyzed and weight of the foot causes it to assume plantar flexed position. What do you call this condition as?
Foot
Foot
drop.
drop. Okay, foot drop. Person will not be able to walk properly also, which is called as stamping gait. Okay, sensory loss. This is all femoral nerve which is shown in blue color. Beta, that will be spared, protected. Rest all are actually loss of sensation because they are all supplied by the branches of sciatic nerve only. No, so sensation is lost below knee except for narrow area, this blue area, except which is actually supplied by saphenous nerve. Except for that, everything, every sensation is lost. Sole also we have, I said no just now, tibial nerve is dividing into medial plantar nerve and lateral plantar nerve. So everything is gone. Okay. So that is, there is one more clinical condition called as sciatica. Generally, we see old people suffering with this. So if there is any slip disc, suppose if if the vertebrae are compressing this nerve, there will be pain along the distribution of the nerve. Patient will complain like there is severe pain at the back of the thigh, at the back of the leg, and along the sole of the foot also. Severe pain will be there. So radiating from buttock down to the leg and can travel as far as the feet and toes. That means still here you will have the pain. Pain is traveling till feet and toes. That condition is sciatica. Okay. So, like if you may be given one clue of sciatica also, and then you are asked to describe sciatic nerve. Sciatic nerve also can be an essay question. I told you slip disc, right? This is the herniated disc, and you are finding the sciatic nerve may be compressed. Okay, so that is prolapse of intervertebral disc. So that causes pressure on sacral plexus, thereby sciatic nerve may be compressed. Okay, sometimes there may be like inflammation of the sciatic nerve. Okay, very rare. Now coming to common peroneal nerve, I said common this is a very good picture, beta. Neck of the fibula, I told you it's very superficial here and it is prone for fractures here. So common peroneal nerve is coming laterally, it is dividing into superficial peroneal nerve and deep peroneal nerve. Superficial supplies lateral compartment, deep supplies front of the leg. So obviously, if common peroneal nerve is damaged, lateral compartment and anterior compartment of leg will suffer. Okay, so that is, it's all like written like it is leaving the popliteal fossa. Common peroneal nerve winds around the neck of the fibula, enters into the peroneus longus muscle. The common peroneal nerve is commonly injured by fractures of neck of the fibula. Sometimes like this plaster casts also, splints generally which are used to immobilize the limbs in case if there is any fracture. If it is used for a long time, there may be compression at this area which may also cause like damage to the nerve. Okay, so common peroneal nerve injury. See, this is foot drop. Okay, so the muscles of the anterior and lateral compartment of the leg are paralyzed. Hence, the opposing muscles, the plantar flexors of the ankle joint and inverters of subtalar joints. Overall, what happens because these muscles are not working, person will suffer with foot drop. Okay, so this is common peroneal nerve. And of course, common peroneal nerve. See, this pink area is the area which is actually supplied by the superficial peroneal nerve. So this area will lose sensation. If you pin prick also, there will not be any pain. Okay, so sensation is lost between the first and second toes. This is first. Okay, and dorsum of the foot, then medial side of the big toe and lateral side of the leg. So all this number 2 area. Okay, so that is losing. Tibial nerve, I said it is supplying the front of the leg, right? So complete division results in clinical, like all the front of the muscles of the leg are paralyzed in case tibial nerve is injured. Okay. Oh, sorry, what I'm telling. Tibial nerve is posterior aspect of the leg, right? So all muscles of the back of the leg and sole are of the foot are paralyzed. So patient will be presenting with thing like this. This is eversion of foot, beta. This is eversion of foot and this is dorsiflexion. So the patient will be presenting with dorsiflexion like this and eversion of foot. Okay, in case of tibial nerve injury. So this is tibial nerve which is supplying the posterior compartment of the leg. Okay, because it is very well protected, like it is between gastrocnemius, below gastrocnemius soleus and in between the tibialis posterior, like flexor digitorum longus and flexor hallucis is well protected. Usually it is not so easily injured better. Okay, so sensory loss. You remember I said tibial nerve is entering into the sole and dividing into medial and lateral plantar nerves. Hence, sensory loss you will see on the lateral side of the leg. The cutaneous division of the tibial nerve is called sural nerve. Cutaneous division of femoral, I said saphenous nerve, and this is sural nerve. Okay. So because there is no nerve supply, sometimes there may be ulcers like this. Okay, local ulcers, they are called as trophic ulcers. Okay. So these are all different type of birth defects if tibial nerve is damaged. So that is all about the extensively we have discussed these nerves. Okay. So then dorsalis pedis artery. Okay. Dorsalis pedis artery is a continuation of which artery, beta? Anybody? Anisha, you remember? Because we discussed, right?
Anterior tibial artery, ma'am.
Ah, very good, very good. Excellent. Anterior tibial artery is a branch of which artery?
Popliteus artery.
Excellent, popliteal artery. Okay. And popliteal artery is a continuation of
Femoral artery.
femoral
Femoral
artery.
artery.
Very, very good.
Femoral artery.
I'm so happy. Femoral artery is a continuation of which artery? I'm checking how strong concepts you are building.
I don't know.
Just go up. Femoral artery above the inguinal ligament.
Inguinal artery.
Sorry, beta.
Inguinal artery.
You have guessed it, but it is not correct, beta. Okay.
I
Anybody?
don't know,
Who
ma'am.
is this answering, by the way? Kitty.
Rohita, ma'am.
Rohita. Nice. Very good, Rohita.
Inguinal arteries, ma'am. Femoral
No,
artery
beta.
above.
Inguinal arteries.
No.
These are only branches of femoral artery. Such artery doesn't exist like main artery. external iliac artery's continuation is femoral artery. Okay.
Yes, ma'am. External iliac artery.
Yeah. Okay. Now let me tell you about this artery now. Now Rohita has beautifully told everything. I am very very happy. See here. Okay, then I will take you first to
Ma'am, external iliac artery, then femoral, then popliteal, then anterior tibial, then dorsal pedis, ma'am.
excellent. You have completed the flow chart. I'm trying to check for this pictures, arteries of Lobeling, so that you will get complete idea. Are you able to see my screen where blood vessels of lower limb are shown?
Yes, ma'am.
Okay.
Yes, ma'am.
See here, beta. See, this is common iliac, which is abdominal aorta will divide into two common iliacs. This is external iliac, this is internal iliac. External iliac is continuing as femoral artery. Femoral artery in the popliteal fossa, now it is named as popliteal artery. Name has changed region wise. Popliteal artery will divide. In the front, it is called as anterior tibial. When it goes behind, you call it as posterior tibial. From the posterior tibial, we have peroneal artery. Got the concept?
Yes, ma'am.
Okay, beta. Khurram, did you understand? Because they have already read, they have very good.
Yes, ma'am.
Okay. Okay, beta. Now I will show you this picture. See here, in this front of the leg, you are finding one artery. Though picture is not has not yet developed, but it is very good picture for us to understand relations also. In fact. Yes, beta. Are you able to see the anterior tibial artery on the screen?
Yes, ma'am. Yes, ma'am.
Huh. So actually anterior tibial artery